Good morning and welcome to your Weekend Healthy Chat. I'm your host, Dr. Sara, and today's guest is Dr. Richard Buckley, who's a cosmetic surgeon at Milford, MD. Good morning and welcome.
Good morning, Dr. Sara, and thank you very much for inviting me.
Well, we're very glad to have you. Now, I understand you're a cosmetic surgeon, so tell us a little bit about what that means and what you do.
Well, cosmetic surgeons help people with their appearance. Sometimes people get confused with plastic surgeons who also help people with their appearance, but they might be more concerned about restoration and function as opposed to simply the appearance.
Mm-hmm. Now, how did you get started in this field?
Well, it's been patient-driven. I've been involved in some form of cosmetic surgery for the last 26 years, but over time we've had more and more tools, such as the neuromodulators, Botox, and fillers such as Juvederm and lasers, which 26 years ago we didn't have. And so patients have brought in their needs, and now that we have more tools, we can better help them.
All right. So what are some of the common things you see in the office on a day-to-day basis?
Well, one of the very common things is people feel young inside and they look in the mirror and they're thinking it's not looking so young. So we're talking about aging and what can be done about aging. And so we work with patients, try and understand their lifestyle and maybe their budget, what they'd like to try to accomplish, what's bothering them, and then focus on those issues.
Okay. So what are some of the typical procedures you do on a day-to-day basis?
Very common procedures. People lose the volume or thickness of their skin over time. Because of that deflation, the skin tends to sag. And so we put various kinds of volumizers in, such as the hyaluronic acid group, Restylane and Juvederm being examples. That helps to plump things back up, whether it's under the eyes or the lips or, those nasolabial folds that form. The skin tends to degrade over time, more or less depending on one's genetics and how careful they've been in the sun. But, pigmentation and blotchiness can appear, and we have great lasers for, erasing those age spots and blending things in and tightening wrinkles. Probably for the last 8 or so years, we've had relaxers such as Botox and then more recently Dysport and Xeomin. And for wrinkles that are caused not simply from loss of volume, but additionally from or maybe only from overactive muscle, that's hyperactive muscles, then we can give something like a Botox and get significant relief from those nasty wrinkles.
And how long does the Botox last for? How long do the treatments last for? Is it something where you need to come back on a regular basis?
Yeah, I think, I've shortened my answers over the years to nothing lasts. People continue to have to feed the dog and have to vacuum and do the dishes and wax the car. And so, why wouldn't doing anything to benefit the body require some upkeep? And it does. To your point, Botox tends to last maybe 4 months after you've done it a few times. Some people get a little more time out of it, but probably 3 times a year will keep up the effect.
Now, is this only for adults, or do you even see younger adolescents as well?
We do see younger adolescents, certainly, and as you might...
What are some of the types of things they come to see?
Yeah,
for?
They don't come for wrinkles, and we don't give them Botox,
not usually, right?
and they don't need fillers unless sometimes, for example, we might do injection rhinoplasty, in other words, to do an instant nose job for them, which we can do with our fillers. But most commonly, the kids have issues with acne, which can be devastating if one's, for example, in high school and you have acne. Is very frustrating and an emotional issue for them.
Yeah.
We can help.
It's frustrating to be a teen alone, let alone to be a teen with acne.
That's absolutely true. But we have tremendous things that we can do today. There are things that were developed out of Harvard by Rox Anderson and his group. For example, photodynamic therapy. We use a medication called Levulin, or we can sometimes treat even without that medication on the skin. But the point is we use a light-based therapy, for example, the blue light or the Omnilux or some of our lasers, to actually really kind of get down in the pores and kill off some of those bacteria that are festering and helping to promote the condition of acne. We have had patients who have been on all manner of antibiotics by mouth and topically and still had a very frustrating case of acne. We've had those same patients a few months later off all medications and having absolutely clear skin after having a series of treatments. And they're non-invasive. They don't go in the body, and so it's beautiful.
Now, how long do those treatments last for acne? Is that something they have to do on a monthly or bi-monthly basis, or is it something that lasts a little while?
Yeah, it's a great question. That's something that in our practice we've seen lasting a good amount of time. I would expect somebody who has a tendency towards acne to maybe have something begin to come back little by little. But we've seen people stay clear for 6 months, 9 months.
Oh, wow, that's great.
With nothing and no medications. It looks like if you can clear up the situation quite nicely and get a baseline of things being in good shape, that can be very lasting.
Now, how young is the youngest patient you see with acne, or that you would do this procedure with?
Teens, so I don't know how young that gets. I think teens probably starts 13, something like that.
Yeah. I even have some 11-year-olds in my practice with pretty bad acne, and you always just feel so bad. So that's great to know that this service is available, because I have some kids who we try everything under the sun, different oral medications, whether it be antibiotics or not, and it's just some kids just don't clear up. Right,
and infrequently today we may occasionally and not very enthusiastically have to prescribe a little bit of Accutane, not in girls, of course, but or not very often in girls, but in order to get it cleared up. So it's another modality that we have, that being our photodynamic therapies and our lasers, to cure up acne without having to resort to some medications that have a lot of concerns.
Absolutely. Yeah. So what are some of the other procedures you see with the young adolescents, or that they come in for, besides the rhinoplasty or the acne?
I think those are the big two
big ones. No, that's good. So what should a person look for when considering cosmetic procedures?
Well, you'd want to see someone in consult, so it's not just emailing them or asking somebody on the phone, so how much does it cost to do something? You'd actually want to be seen in person. And the person you would see would want to be somebody who's very experienced with the kinds of things that you might be considering. We have seen, for example, patients evaluated maybe even by a plastic surgeon or a dermatologist who has a good reputation. However, that person actually doesn't really do Botox, or they don't really have any lasers that live in their office. Their thought was maybe they'll rent something, they'll try something, they'll learn about it. Right. These things are highly specialized, meaning the lasers and Botox and the fillers, and there's a learning curve, and you would want to go someplace where the people who are having a look at your issues and listening to you have a lot of experience and can guide you through the variety of options that are available for having an excellent result.
Absolutely. And someone who does it on a day-to-day basis.
Yeah. Unfortunately, I'm not sure that the public understands that this is artwork. So, for example, a common question might be, well, how much does Botox cost? And sometimes people will charge by the so-called unit, or other times, people will charge by an area. But to my way of thinking and my experience, that's not the right question. How much does it cost? The real question is, does the person you're going to understand the aesthetic? Do they understand the underlying anatomy? And do they have a wealth of experience in administering the product? And are they into the art form? And those are much more important questions than how much does it cost.
Absolutely, especially when dealing something so precious as with the face.
Absolutely.
Yeah. Well, that's great. We'll be right back after this. Welcome back. We're here with Dr. Richard Buckley, and we're discussing cosmetic surgery and things he offers in his office located at Milford, MD. So I know we talked a little bit about acne and some of the things different patients come in for. Now, are you seeing more males these days for cosmetic surgeries, and what are they coming in for?
We are seeing more guys than, say, 15 or 20 years ago. Guys have somewhat different concerns as a group than girls. However,
they're not as worried about wrinkles as I am.
as a group,
Yeah.
Guys do worry about wrinkles. Today I'm treating a guy for wrinkles, and he's getting fillers and he's getting Botox. So, definitely every day there are guys getting those fixed. But, they're concerned about, for example, their rosacea on their face.
And what is rosacea?
Yeah, well, it's kind of a kissing cousin to acne. It's sort of fostered by genes giving you sensitive skin, such as, Northern European, Irish, English, Scottish. And you'll see the face gets flushed very easily. Maybe a little blood vessels, so-called telangiectasias there. And not infrequently, those so-called broken blood vessels, not actually broken, might be even on the nose. And so there's a red nose. Gone really far, and then you get rhinophyma as the big nose that the schnoz, Jimmy Durante used to have. But that can be prevented. Kind of old style and still a little useful today. Medications, such as Noritate, Metrogel, maybe even an antibiotic by mouth, such as the cyclines, minocycline. However, we have fantastic lasers that will specifically target the color in those vessels, oxyhemoglobin, and they will shut that down so the vessels can go away. Now, some people, and guys are, as a group, not very good about sunscreens. Girls are much, much better. So guys might be working outside doing construction. The sun is not helping their rosacea any. And now they have a red nose, and so they're thinking that people are thinking that they're drinking, and they're not drinking. So they'll come in and kind of get that cleared up so that they're not thinking that people are thinking bad things about them.
Exactly.
So that's a big thing for guys. Guys do a lot of lipo sculpting, especially...
What's lipo sculpting?
Lipo sculpting is very finely done liposuction with an attention to details and regaining the curves that one had when one was younger, as opposed to the pot belly or the love handles. So guys are big about that. Now, there's some differences in areas. So, for example, it's extremely uncommon to do lipo sculpting of a guy's thighs. Women, we do it all the time. Inner, outer thighs, inner knees, very, very common. Front of the thighs. Guys, not. We do liposculpting of male chest. Some people have, a large chest, much as a woman, and the guys don't like that, and they're afraid to go to the beach and afraid to go to the gym, and so we have great solutions for that.
Now, is that procedure painful, liposculpting?
Well, we do it with patients wide awake, but they're totally comfortable because they have received a numbing solution called tumescent anesthesia. And we, as amazing as it may sound, we talk and tell jokes and we listen to music and we have a good time while the procedure is ongoing.
That's great. So now what are some of the good reasons or the bad reasons to choose cosmetic surgery?
Well, a bad reason would be if somebody else thought that you should have cosmetic surgery. I have had, for example, husbands bring wives, and then the husband would say, you have to do something with my wife. Look how she doesn't look that great. And I think that's not nice at all. And I've separated those people and had a psychological chat with both of them, so that's always worked out well. But I think to do anything, the person who's going to receive that benefit should want that for themselves. I'm also very reluctant to do procedures if somebody feels they're in dire straits, and if they would only maybe plump up their lips, that would save their marriage. And so you have
to look at the bigger picture versus just
I think we have to have reasonable expectations and work from that perspective all the time.
No, absolutely. And what are some of the good reasons to have?
Good reasons, we've seen basically life-changing effects on people pretty much interestingly every day. So, people come in and they're feeling okay, but could you do a little help with my forehead wrinkles or my nasolabial folds or my lips or my blotchiness or whatever, and we do that. And then we find out that they're kind of much more excited about life after that. Oh my gosh, this is so great. And do they want to do a few more things? Sure, that's usually what happens. But it's nice to be able to help people feel better about themselves, to be more confident, and even more confident in the workplace. We do see a lot of patients from Manhattan, from Long Island, from New Jersey, who are, for example, executive women, and maybe they're older than they were, and they have the feeling that there's some younger women who would love to have their job, and so not only do they need to be very functional, but they also need to look the part, and so they come to us and ask for that kind of help. We're able to help them with that. That's great. Yeah.
Oh, that's great. So any final tips before our segment ends?
Well, a tip would be, not to be overly vain about things, but if there are some issues that are of concern, maybe something that Mother Nature put there, maybe it's a mole that you'd like to get rid of, and many things can be done simply. I think that probably the public isn't quite sure how simply some of those things can be done. If you're afraid, then maybe you don't check and you don't get it done. But I would say, see somebody who's an expert at, making cosmetic improvement. Find out what's possible, how much it costs. Talk about how you'll feel and look and how others might treat you differently afterwards. And, be willing to explore that a little bit. We have tremendous things we can do for people that can be actually life-changing.
No, that's great. And again, do you just want to touch base on where you're located and how someone can get access to you?
Sure, thank you. We are in Milford, Pennsylvania, beautiful Milford. Forestry Department of America started right in Milford, the Yale School of Forestry. We're right on one of the main streets there at 303 West Hartford Street. We have a website, milfordmd.com, with a lot of information, and we try to put more there every few days. And so we'd encourage people to go there and hopefully get some answers to questions that they might have. And anybody who would love to understand how we can help them specifically, we'd love to see them.
No, that's great. And they typically make an appointment for like a consultation and then go from there?
That's absolutely true.
Okay, great. Well, thank you so much for being here today. We appreciate it.
Thank you, Dr. Sara. It's been fun.
Great. Welcome back. Now's the time in our segment for our email question of the week. And this one comes to us from a mom in Milford. And she writes, Dr. Sara, it's that time of year. School has started and so have the colds. My 5-year-old came home the other day from kindergarten with a runny nose and just started coughing last night. What can I do to prevent it from becoming anything worse? Well, this is a great question. And yes, cough and cold season has started, as we've seen quite a few cases in the office over the past week. So what we say, when the runny nose starts, start your nasal saline drops or a nasal saline spray really to help dry out the nasal cavity. You want to elevate the head of their bed, put an extra pillow or two underneath them just to encourage proper drainage. You want to use a humidifier if you have one in their room at nighttime, as well as apply a vapor rub to the chest. And this will really help open up the nose and the lungs. Now, if they're not improving after about 72 hours or your little one develops a fever, it's always a good idea to bring them into your pediatrician's office just to be evaluated. So I hope this helps and good luck during the cough and cold season. Now, I just want to say thank you again to Dr. Richard Buckley for being with us today. He's a cosmetic surgeon out of Milford, MD. So thank you for being here and discussing what you do all day, every day. And for those of you with further pediatric questions, please feel free to see me at the Port Jervis Center for Primary Care, located at 140 Hammond Street, where walk-ins are always welcome. I hope you have an active and healthy week ahead, and I'll see you again next week.